In the modern world, where life expectancy is constantly increasing, maintaining health in old age has become particularly relevant. One of the most common problems among older adults is joint and muscle pain, which significantly limits mobility and reduces quality of life. According to data from the World Health Organization (WHO), more than 80% of people over 65 experience discomfort during movement, and about 40% suffer from chronic musculoskeletal disorders. The issue of mobility in old age has complex causes. With age, the natural production of collagen, the protein that forms the basis of cartilage tissue, decreases. This leads to thinning of cartilage and deterioration of its shock-absorbing properties. Additionally, tissue regeneration slows down, muscle mass decreases, and blood circulation in peripheral parts of the body worsens. Together, these factors create conditions for the development of various joint diseases. The question of maintaining activity is especially critical for older adults because limiting physical activity can trigger a vicious cycle. The less a person moves, the worse their musculoskeletal system becomes, further restricting their ability to move. Therefore, finding safe and effective ways to maintain mobility has become a priority for doctors and their patients. Among the many methods available for preventing and treating joint pain, nutrition plays a special role. Modern research shows that a proper diet can significantly affect joint and muscle health, slow aging processes, and improve overall well-being. For this reason, dietary recommendations from doctors for maintaining mobility in old age are not just a useful addition to treatment, but a key element of a comprehensive approach to preserving health. Fish oil, a key to joint health. The first product doctors strongly recommend for maintaining mobility is fish oil. This unique natural source of omega-3 fatty acids has a complex effect on the human body. The main components of fish oil, like eicosapentaenoic acid (EPA) and docosahexaenoic acid (DA), play a crucial role in maintaining joint health and reducing inflammatory processes. The primary mechanism of action of omega-3 fatty acids lies in their anti-inflammatory properties. They suppress the production of pro-inflammatory prostaglandins and leukotrienes, which are the main mediators of inflammation in the body. Studies have shown that regular consumption of fish oil helps reduce levels of C-reactive protein, a marker of inflammation in the body, by 15 to 30%. This is especially important for older adults, as chronic inflammation is one of the main causes of cartilage breakdown. In addition, omega-3 fatty acids stimulate the production of proteoglycan substances that ensure the moisture and elasticity of cartilage tissue. They also improve microcirculation in the joints, promoting better nourishment of cartilage and slowing its degeneration. Clinical studies demonstrate that taking fish oil containing 2 to 3 grams of EPA and DHA daily can reduce joint pain intensity by 40 to 50% in patients with osteoarthritis. The proven effectiveness of fish oil in preventing and treating joint diseases is supported by numerous scientific studies. A meta-analysis of 17 randomized controlled trials conducted in 2018 showed that patients taking fish oil supplements reported significant improvements in joint mobility and reduced reliance on nonsteroidal anti-inflammatory drugs and SAIDs. Remarkably, the effects persisted even after discontinuing the supplements. It's important to note that the benefits of fish oil are not limited to joint health. Omega-3 fatty acids also improve cardiovascular function, support brain and nervous system health, especially valuable for older adults, and help normalize cholesterol and triglyceride levels, further reducing the risk of heart disease. For maximum effect, it's recommended to obtain omega-3 fatty acids both from dietary sources, fatty fish such as salmon, mackerel, and herring, and high-quality supplements. This is particularly important for those who cannot regularly consume enough fatty fish. However, when choosing supplements, it's essential to pay attention to their purity and concentration of active ingredients, as well as consult a doctor for optimal dosage. Gelatin, building material for cartilage. The second important product for maintaining mobility in old age is gelatin, a natural source of collagen, which forms the basis of cartilage tissue. This unique protein product is derived from animal connective tissue and contains highly concentrated amino acids necessary for joint health. Glycine, proline, and hydroxyproline are particularly valuable as they are the main building blocks of collagen. The mechanism of gelatin's action is based on its ability to stimulate the body's own collagen production. When consumed, the amino acids in gelatin are absorbed and directed to the joints, where they serve as building material for restoring and maintaining cartilage tissue. This property is especially important for older adults whose natural collagen production significantly decreases with age. Scientific studies confirm the positive impact of gelatin on joint health. In one major study published in Clinical Rheumatology, 100 patients with knee osteoarthritis participated. After 6 months of regular gelatin consumption, 10 grams per day, participants noted a 35% improvement in joint mobility and a significant reduction in pain. Ultrasound examinations showed an increase in cartilage thickness of 2 to 3 millimeters in most patients. Particularly noteworthy are the results of long-term observations of older adults who regularly consumed gelatin for 2 years. A study conducted at the University of Cincinnati demonstrated that these patients had a 40% lower risk of osteoarthritis progression compared to the control group. Additionally, they experienced slower cartilage degradation and improved regenerative capacity. Gelatin also has the unique ability to bind water, helping maintain the necessary moisture in cartilage tissue. This is especially important for older adults, as the ability of cartilage to retain moisture decreases significantly with age. Thanks to this property, gelatin improves the shock-absorbing characteristics of joints and reduces stress during movement. It's worth noting that gelatin not only supports joint health, but also positively affects skin, nails, and hair. It strengthens connective tissue throughout the body, which is particularly valuable in old age. Moreover, gelatin is easily absorbed by the body and has virtually no contraindications, making it ideal for long-term use. For maximum effect, it's recommended to consume 5 to 10 grams of gelatin daily. It can be added to various dishes such as jelly, mousses, aspic, or jellied meat. Special gelatin-based supplements are also available, ensuring precise dosing and convenient application. Ginger, a natural pain reliever. The third key product for maintaining mobility in old age is ginger, a unique plant with powerful anti-inflammatory and analgesic properties. Active compounds in ginger, particularly gingerols and chagols, act similarly to nonsteroidal anti-inflammatory drugs and SAIDs, but without their side effects. This makes ginger especially valuable for older adults who often cannot tolerate traditional painkillers. The primary mechanism of ginger's action lies in its ability to inhibit enzymes cyclooxygenase 2, COX-2, and lipoxygenase, which are involved in the production of pro-inflammatory prostaglandins and leukotrienes. Studies have shown that ginger extract can reduce levels of pro-inflammatory cytokines TNF-alpha, IL-1 beta, IL-6 by 30 to 40%, comparable to the effects of some medications. Importantly, ginger acts gently and gradually, avoiding abrupt chemical imbalances in the body. Clinical studies confirm the high efficacy of ginger in combating joint pain. A meta-analysis of 16 randomized controlled trials, published in Arthritis Research and Therapy, showed that consuming 1 to 2 grams of dried ginger or 250 to 500 milligrams of standardized extract daily reduces pain intensity by 40 to 50% in patients with osteoarthritis. Interestingly, the effect builds gradually and reaches its peak after 3 to 4 months of regular use. Particularly impressive are the results of long-term observations of older adults who consume ginger regularly for a year. A study conducted by the Institute of Nutrition and Health in Delhi demonstrated that these patients not only experienced reduced pain intensity, but also improved joint functionality. Participants reported a 60% increase in the distance they could walk without pain, as well as better sleep quality and overall well-being. Ginger also has the unique ability to improve microcirculation in the joints, promoting better nourishment of cartilage tissue and accelerating regeneration processes. Additionally, it stimulates the production of antioxidant enzymes, protecting joints from oxidative stress, one of the main factors in tissue aging. It's important to note that ginger not only alleviates pain, but also provides general strengthening benefits. It improves digestion, boosts the immune system, and helps combat chronic fatigue, common companions of old age. Ginger can be consumed in various forms: fresh root, dried powder, extracts, or supplements. Combining the 3 products for maximum effect. For the best results, it's recommended to combine the consumption of all 3 products: fish oil, gelatin, and ginger. The combined action of these natural remedies achieves better outcomes than using each separately. Fish oil fights inflammation, gelatin restores cartilage tissue, and ginger acts as a natural pain reliever while improving blood circulation. However, it's important to remember that noticeable effects require regular use of these products over several months. Their intake should also be combined with moderate physical activity and a healthy lifestyle. If serious joint problems exist, consulting a doctor is essential to rule out contraindications and determine the optimal dosage. These simple yet effective recommendations can help older adults maintain mobility and independence, avoid pain, and continue leading an active life. Including these 3 products in your daily diet can be an important step toward healthy aging and preserving quality of life in old age.